Hello, and welcome to the UCSF Primary Care General Internal Medicine Residency Training Program, or UCPC-Gim.
We are thrilled you have decided to interview with us and are also very grateful that you're taking the time to watch this video.
We wanted to share with you some highlights of our program and, even more importantly, provide an opportunity to hear from our recent graduates as well as get the experiences of our current residents.
But first, we wanted to share a little bit about ourselves. My name's Ryan Laponis, and I'm an avid urban cyclist, a drip coffee enthusiast, and father to some delightful yet rambunctious children, who also teaches education and communication skills throughout UCSF and beyond.
And hello, everyone. I'm Ira Krzyzanowskaya, and I'm so pumped that you're applying to this awesome program. I'm an East Coast transplant, MedEd podcaster, primary care addiction medicine clinic director, and a shooting guard whose basketball skills definitely peaked in high school, but who continues to play on SF rec leagues nonetheless.
And I'm Nia Feliz Williams, and I'm so excited to meet you. I'm a hiker, board game lover, and cooking enthusiast, and I'm deeply passionate about quality improvement of care for patients with limited English proficiency, anti-oppressiveness in medicine, as well as mentorship and sponsorship.
As program leaders, our collective goal is to train leaders in primary care who are committed to building equity into healthcare. We provide outstanding clinical training in both inpatient and outpatient settings, while fostering resident skills to lead meaningful change in healthcare. Graduates of our program have gone on to become leaders in all aspects of general medicine, including academics, research, health systems innovation, public policy and advocacy, medical education, and community-based primary care.
I chose to come to UCPC because the program's values closely align with my own. Overall, there is a very strong culture of respect. Respect for the patients, respect for the clinic staff, respect for trainees, and so on, which unites around the common goal of providing high-quality, evidence-based care for patients with incredibly diverse attributes and needs. There is an emphasis on team-based care and team-based work, which provides a really realistic and holistic representation of how we will build our careers around becoming physician leaders.
I chose UCPC because the program aligned with my goals of wanting to care for socioeconomically, medically, and culturally diverse populations. Also, the people here have been so warm and welcoming. My mentors so far have been very invested in my interests and future career goals, and my co-residents have become essentially family.
What excites you about the program?
Good vibes.
The people.
Sense of community within a larger program.
The ability to personalize my career. Taking care of my community.
An excitement about general medicine.
Intentionality about every aspect of the program.
Just having a home within residency to come back to. Feeling accepted by a community around singing both the Arthur's theme song and Tuesday by I Love McConan, my two favorite songs.
One of the really cool things about this program is that it's big enough that you can find a niche in whatever you're interested in. There is amazing research going on here, and you could work with people doing unbelievable research in pretty much any area of internal medicine. At the same time, you could also develop your skills as an educator or work on a track that has nothing to do with research. So that was something that attracted me, the flexibility and also just how amazing the people are in all of those different areas of internal medicine.
My favorite thing about UCPC is how much support there is for coming up with the path that works for you. There is so much mentorship and so much support to pursue your individual passion. I was able to create my own type of pathway that met all of the needs that I had, both for clinical research, some informatics, and for some health systems work. And the unique thing about UCPC and UCSF in general is that the hierarchy for leadership is flat and you can go to anybody and get all of the mentorship, support, advising, research advice, anything, no matter who you go to. And they show up for you in whatever your passion is.
What allows us to provide outstanding training in primary care is the diversity of patients that we see. At our Mount Zion General Medicine Clinic, we have the most diverse patient population of any site within the UCSF system.
The reason why I chose to come here and why I love this program is the diversity of patients I get to see. Everyone from like the most underserved in San Francisco to the most wealthy tech people in San Francisco are all on my patient panel. I think that just lends itself to really great training and learning for me as a budding primary care provider.
Because we accept all insurances, we get to see patients from all walks of life, from those who are incredibly medically complex, coming from Moffitt, to some more bread and butter, general internal medicine, to patients who are really struggling socioeconomically. And I feel like I'm getting a really broad training that I'll get to carry forward with me.
We are committed to help you become the leader, master clinician, researcher, innovative educator that you want to be, with our deep network of dedicated mentors who are passionate about providing you individualized and consistent career guidance along your residency journey. We have structured the residency experience such that you are supported by your colleagues, near peers, and faculty to learn the core principles of primary care practice, to find joy in your community, and to help you become the leader you want to be.
What I really love and appreciate about UCPC is that the program leadership has really facilitated me exploring my very varied interests in general internal medicine, and to give a sense of what the variety of experiences that a UCPC resident might have. For this week, for instance, on Tuesday, I was at the Department of Public Health's Sexually Transmitted Infection Clinic. On Wednesday and Thursday, I was at my longitudinal rural health rotation, where I sometimes am in person and sometimes am doing telehealth, seeing patients in Clear Lake, California, which is around 2.5 hours north of San Francisco. It is a pretty resource-limited healthcare setting. And then on Friday in the morning, I was participating in our health equity didactics, advocating for some current bills that are on the governor's desk right now that pertain to healthcare. And then Friday afternoon, I was in the Sim Center learning how to run codes. So still getting a little taste of inpatient medicine as well.
We have developed a curriculum that provides core experiences in order to build the knowledge base and skills that you need to be successful in general internal medicine. That core curriculum is balanced with opportunities for individualization, with electives and experiences that are unique to your particular professional goals. The curriculum also allows you to build skills in population health, panel management, advocacy and equity, and systems-based practice, all with an understanding of the history and impact of the oppressiveness in healthcare so that you can work effectively in any health system with any set of patients once you finish your training.
I wanted to have a career where I felt I could impact people's lives and their health by being able to tackle these issues together and addressing social determinants of health together. Being here at UCPC and at UCSF allows me that opportunity because I'm surrounded by people who care about the same issues, who care about advocacy and justice, and help give me the resources and give me the training so that I can be that kind of physician, the one who advocates for my patients, the one who sees them where they are and helps them to every day grow and hopefully live healthy and happy lives.
I think one of the coolest things about UCPC is the didactic programming that we have during the R2 and R3 year. It's not just that we have an extra month of block every year, it's that during block we have these carved out times to do all of the things that are really important for a general primary care doctor. And so what does that look like? The first part is RSP time, or what's like scholarly time that's blocked out 1 to 2 afternoons every week that you have time to meet with people you think are interesting, try and find your own interesting project about something you're passionate about. So for me, I'm interested in health tech innovation, so I've been getting time to set up meetings with people who are doing cool work in the system, and then also think about what kind of scholarly project I'd like to do over the next couple of years, which is unique and curated and lets me pursue my own curiosity. But also there's all of these other curated tracks. So there's a QI didactic program where we both get to learn about how to do a QI project, but there's also someone has already done all of the pre-work for us to be able to do and execute a QI project over each year. So this year we're doing increasing colorectal screening rates in our clinic, which is awesome. And by the end of a year, we'll actually be able to see how we've impacted our patients, not just didactically learned about something in the classroom. We also have an advocacy track where we learn about health policy and the actual nuts and bolts of how to understand what policies are impacting our patients, but also we have a day where we go to Sacramento and we get to actually advocate for our patients in conjunction with community programs like GLIDE and community partners that we work with. So that is another key thing that we can point to that we have achieved and not just learned about during that time.
What I would want applicants to know about UCPC is that it welcomes in new members with open arms and open hearts. It's a really strong community of folks who support one another through good times and hard times.
Thank you for taking the time to learn more about our program.
We look forward to learning more about you and your goals.
And we can't wait to introduce you to the UCPC residents. See you soon.